Hi, I'm Dr. Amber Fritsch, and I'm an optometrist here at Precision Eye Care in Mount Juliet, Tennessee. A question that I get a lot is, how old does my kid need to be before they get their eye exam? Now, we've all seen those adorable social media videos of these babies getting their glasses, seeing for the first time, seeing their environment for the first time, seeing mom and dad for the first time, and their face just lights up. And in those comments, I always see, well, how did they know that this child needed glasses? Or how did they know what glasses this child needed? Believe it or not, we actually recommend doing an exam on babies between 6 and 12 months old. That's a recommendation from the American Optometric Association, and through the InfantSEE program, that exam is actually no cost, so no reason not to do it. But during that exam, we're actually able to identify the child's prescription, if they're nearsighted, if they're farsighted, if they have astigmatism, as well as if they're seeing at an age-appropriate level. We use a series of flashlights. It's a super fun exam. The babies love it. We love it because it's just fun. We also recommend an exam at 3 years old, 5 years old, and every year while they're in school. And again, that's a recommendation from the AOA or the American Optometric Association. We recommend this regardless of if the child is showing any symptoms or if the parent is having any concerns. Kids often don't speak up if they're not seeing as well as their peers because they don't know any different. This is just how they see. This is how they've always seen, and it's normal for them. So we always want to make sure we're getting them in and making sure that we're addressing any prescription needs, that those eyes are working well together, and that everything is healthy. Now we know that there are screenings that are done at the pediatrician and at school, and hey, it's great. The more information we have, or the more kids we're catching with that, fantastic. We still encourage you to have those exams with your eye care provider, just again because we're looking at a little bit more versus what they're looking at on that screening. As a mom, I know our kids are important. We want them to succeed. We want them to do well. We want them to do well in school. So we need to set them up for success and make sure that they have all the tools that they need to do so. If you have any questions about when it's appropriate for your child to have an exam, drop them in the comments below or talk to your eye care provider.